number of new COVID-19 cases has been on the rise in the past few days. According to the latest figures, the cases increased by over 3,220, putting the number of active cases at 29,311. The Department of Health says it's closely monitoring the situation. Professor Mosa Moshabela from the University of KwaZulu-Natal joins me now. Maybe he won't stumble over the figures like I am. Thank you so much for your time, Professor. We do appreciate it. Maybe let's just speak about the worrying, the concern around how our numbers are increasing. Is this something to be worried about?
Good evening, Heidi, and to the viewers. This is something to pay attention to, Heidi, to observe and to monitor. But I think in general, we have to recognize that it is the beginning of the fifth wave. We cannot ignore that fact anymore, because for the numbers that we have now, up to this point, and all the trends that we've been watching, starting with the water surveillance from the beginning of the end of March, and also now these numbers, the cases that we are seeing, it really gives us a clear trend that we are beginning to see the start of the fifth wave. So for that reason, we can expect that a lot of people are going to be infected. Some people will end up in hospital. Hopefully, it will be a relatively small number, as we saw in November, December, January. But also some people we may lose during this period, during the surge.
I want us to speak about whether or not there's a new variant or a variant of concern that's driving this new infection increase, or is it still Omicron and a number of other variants that we are looking at here?
Yeah, I mean, historically, every wave was driven by a different variant. The last one was driven by Omicron. Currently, the wave that we are now entering into, currently, the evidence shows that it's driven by subtypes of or subvariants of Omicron. So in November, December, we saw BA1 and 2. Now we are seeing BA4 and 5. So basically, we are still with Omicron, but it's different subtypes of Omicron that are currently dominant in South Africa.
Professor, I want us to speak about the concerning number of people vaccinated in the country. We know government has been at pains to get people to vaccination sites to either get their first or second vaccine, but also to get their booster jabs. There seems to be a lot of hesitancy and resistance. Speak to us about how important it is to get vaccinated if you aren't vaccinated yet, but also to perhaps go for your booster if you haven't really considered going for that yet.
Yeah, I think overall we know that vaccination offers protection against a variety of variants, including the ones that we have. We've noted with the current subvariants that we are seeing, BA4 and 5, that there is a lot more reinfections, which means that the data later will likely to show that it can escape immunity. Therefore, we need to make sure that people who are at the most risk of COVID-19 severe disease are vaccinated, those with comorbidities that are risk factors, as well as those who are above 50, especially those who are above 60. They must be vaccinated, but also up to date in terms of their boosters, so that their antibody levels can be high enough to protect them, largely from the invasion of COVID-19. But certainly we hope that they will be protected from severe disease. So this is important. And generally we know that our vaccination program has come to a standstill in South Africa. We may be able to benefit again from infection immunity for those who have recovered recently in the Omicron wave in November, December. But we can't guarantee protection from the infection. It's better, really, if people can guarantee protection from vaccination.
And then just lastly, Professor, I remember last year and the year before, when it was probably last year only, because we only started fully vaccinating last year. If you had received the flu vaccine, you were advised not to get vaccinated, or rather wait some time before you go and get your COVID-19 vaccine. But there seems to be a different message now, that you should get your COVID-19 vaccine and also get your flu vaccine. Why should that be the case?
Okay, so I think firstly, in terms of what happened before, it was because we were still learning about the COVID-19 vaccines. We didn't know how people were going to react when they go large scale. Now we know enough. So we were worried about the possible interaction between the reaction that you get from a vaccine for COVID-19 and for flu. Now we don't worry about that anymore. You can get it at the same time. Some people suggest that you get it in different arms to limit local reactions and so forth. But it's important to get the flu vaccine with COVID-19 vaccine as well because of co-infections. Ever since 2020, 2021, especially last year, we saw increasing evidence of serious disease from COVID-19 co-infecting people together with other respiratory pathogens. And this may include viruses, including flu, but also bacteria. And this is becoming a serious problem. It looks like, in a way, COVID-19 enables other respiratory pathogens to also take hold and cause disease. So this is why it's important that people can be protected as much as possible from other respiratory pathogens.
Certainly. Isn't it also strange how things have changed? Last year, South Africans were queuing and so desperate to get vaccinated, and this year, most of our vaccination sites are empty. But thank you so much for your insight. We do appreciate it. That is Professor Mosa Moshabela, who is from the University of KwaZulu-Natal. And as you heard, this is the beginning of our fifth wave.